awareness, accuracy, and resources. Dr. Sumit Ray, a critical care specialist, mentioned the concept of attributable mortality to suggest that it is difficult to reach an exact number of deaths due to the infection in India. Usually, the possibility is considered when, despite observing improvements in other conditions that the patient is suffering with, his or her condition continues to deteriorate. Both Professor Lakshminarayan and Dr. Ray pointed towards the problem of the costs of these drugs. Dr. Sumit Ray said, in India's over-privatized system, financial strain on patients is already too much. Fungal infections are not a very large share of hospital-acquired infections, he adds. We become prone to these infections because of the overuse of antibiotics. In the process of killing bad bacteria, we also kill the good ones. Prescribing strong antibiotics to a patient whose immunity is already compromised or who has diabetes, for instance, increases their chances of getting infected. Dr. Isabel further explained that India lacks the required resources and capital to test and treat such infections. She says, C. auris can be detected in ICUs using lab tests. However, many Indian hospitals do not have the facilities, resources, or staff time to do this. In fact, some of the most common technologies for identifying fungal strains can misidentify C. auris as another fungus, which may have hindered control of this strain. So what can be done? Measures to prevent and control the spread of the infection need to be taken at multiple levels. Dr. Ray and Dr. Strost mention a few. At the hospital, we need proper infection control through regular cleaning, changing, sanitizing, and the use of disinfectants. Second, policies on the availability and prescription of these drugs need to be made and implemented to ensure that drugs are consumed only when necessary. Consumers should be asked to explain and provide evidence to be able to buy any such medication. While such policies exist, their implementation needs to be made sterner. In addition, Dr. Frost discusses the need for better and improved research in the area. Even though studying antifungals may be difficult because fungi are much more biologically similar to humans than bacteria. She says, however, resistance to both antibiotics and antifungals is an emerging threat to global health and requires sustained efforts to develop new treatments. Professor Lakshminarayan agreed that eventually everything boils down to the problem of overuse. He says, we have a serious health crisis. We need to make sure that we conserve the drugs we have while investing in new ones.